Cancer is no easy topic to talk about, especially if you're dealing with it or with someone that has it and you're around them and you're a close one. That's why cancer foundations are made for, and donating to them it's a huge contribution. I plan to remark the importance of donating towards these treatment foundations, and the reason it may be important to the people, you and me, is because of every 100,000 people, 190 is going to suffer from this disease. I plan to address about cancer education, prevention, early detection, quality of life, and end of life issues. So we need to begin with asking ourselves what is cancer, so we can know what we're dealing with and how to deal with it. As the cancer.gov website states, cancer is a disease in which blood cells grow without control and spread to other parts of the body, which is made of trillions of cells. These cells can form tumors, which can be divided in cancerous, and uncancerous, which is the benign cancer. There are more than 100 types of them, and I'm just going to mention a few of them because there are a lot. So the first one is going to be sarcoma, which is formed in the bone and soft tissue, which can be muscle, fat, blood vessels, lymph vessels, and fibrous tissue, which is ligaments and tendons. Leukemia don't form any tumors, but they grow a very large amount of white blood cells. And then we have lymphoma, myeloma, melanoma, carcinoid, and a lot more of them. If you want more information about this in the description, you can go into the cancer.gov website. After we know what we're dealing with, we need to figure out how we're gonna address this. So how to deal with cancer, we need to find information and help. And the first one is gonna be medically. So we need to go in the right direction with a specialist by running tests and identify the particular case we have, and then guide us towards the options we have available. Then there's the emotional part, which is the mental health. And this one is going to be the main pillar through all the fight. But the foundation of the main pillar is going to be family and friends, your loved ones. Being informed and stay positive is very important. And then IH stated it is 4 times more probable to beat down cancer if you stay positive, you have hope, and you trust the process. And it's better than having negative thoughts. We're humans, and that includes emotions, but fighting emotions is also part of the deal. Then we have the financial part, and according to NIH, this is the part where 25 to 50% of the people that survive cancer are deep with economic hardships. Let's say that you sold your house so you could afford your treatment, and now it's going to be very hard for you. So one thing we can do to avoid these situations is to have health insurance. And thanks to the ACA, which is the Affordable Care Act, now health insurances cannot deny coverage to us, even if, let's say I have cancer and I go to them, hey, I have cancer, I need insurance. Now they're obliged to give you insurance and coverage. They cannot say no, and that's also for your children or whoever it is. And when things don't go the way we hope for, and you know what, you just have a few years left, months, days, I don't know, then we need to address this by taking care of the patient. And there are symptoms you're going to notice, which is going to be the need to sleep a lot, weight loss, little appetite, and the decreased ability to talk and concentrate. It is written on the cancers.net website that providing comfort can help the patient, and it is important to ease any physical discomfort, but it may be hard for your loved ones to let you know when they're uncomfortable. And experiencing exhaustion, fatigue, and mental confusion, this can affect even the patient or you because it's very hard. And but the way we can help the patient is to speak clear in a calm voice, remind them of the time, place, and who's present. And if the person is withdrawn or unresponsive, say things, do not ask them, how are you? How are you feeling? We already know, or we don't even know how it feels, but just say things like everything is going to be all right, we're here with you, or we love you. And respecting your loved one's wishes, this is an important fact that needs to be firmly applied. There might be occasions where you're alone and or you don't have the financial access or you're just disoriented and you don't know where to begin with. That's where these foundations can help. So Rio Grande Cancer Foundation is one of them, and you can find with them financial support if you really need it. There's beauty programs for women. They have support groups and psychological assistance. And for example, a little donation of $35 can give a wig for someone that needs it. And there's general information or direction to other associations. There is help and support to those who seek it. Even being the direct patient's family can go and ask for help. In this page, I address about cancer education, how to prevent it, early detection, how quality of life is affected, and end-of-life issues. And I encourage all of us to help however we can. We don't know if we're going to be in need of that kind of help at some point of our lives. I hope not. But I can tell you, feeling the support from humanity is priceless. It is a big dose of faith and hope to keep fighting. More information can be found at Rio Grande Cancer Foundation in person or through their website. That's all. Thank you.